Now, and I'll start off with a roll call. And I think the roll call is... Oh, is that right? Yeah. First, I'll introduce myself. I'm Senior Senator Bruce Steer from San Francisco, PSA 6. And before we introduce the members of the committee, I'd like to introduce the. Well, I'll let you introduce yourselves. I think that would be better.
My name is Yuli Choi O'Brien, and I'm from the Office of Legislative Counsel.
And she is the Deputy Attorney. Deputy Counsel.
Hi, I'm Lisa Cyril, and I'm your Resource Secretary, and I work for the California Department of Public Health.
And your job is to make sure everything is legal.
Yes, and well, she makes sure it's legal. I record it.
Okay, I'd like now to introduce anybody else.
She's a runner waiting for Senior Senator Lucero. After we're done calling roll, he's needed.
Okay. I'd like now to have the roll called.
Okay. Senior Senator Steer.
Here.
Senior Senator Ehrman.
Here.
Senior Senator Jaffe.
Here. We're going to have to stop meeting like this.
Yes, exactly. Senior Senator Casper.
Here.
Senior Senator Miller.
Here.
Senior Senator Woods.
Here.
Senior Senator Lucero.
Here.
And Senior Senator Fromm.
Here. Thank you.
Great.
That's it. So we have full attendance, so a quorum has been established.
Correct.
And I think now I'd like the members of the Health Committee to introduce themselves.
I'm Austin Lucero from PSA 10, representing the county of Santa Clara, and I'm new to this committee. I'm new to the Senate, but I'm old to CSL. You're next.
Introduce yourself.
Bob Jaffe, I'm from PSA 10, Santa Clara County.
I'm Dee Ehrman, and I represent Orange County, PSA 22.
I'm Edward Woods from PSA 25, Los Angeles City.
Erwin Fromm, PSA 21, Rancho Mirage.
Sandra Miller, PSA 5 in Marin County.
Ann Casper, PSA 21, Riverside.
We got a majority.
See what they're doing here. I'm not sure what's going on. Should be Kim Selby. I'm sorry. Yeah, that should have been it.
We have Senior Senator Thompson who's here to present on SFP4.
Oh, SS24?
SFP4.
213. Want me to sit up here?
Yeah, thank you.
Is somebody going after Kim Selby?
Yes.
Okay, thank you.
Good afternoon.
Hello there.
My proposal, I
Could you
presented...
introduce yourself first, please?
I'm sorry. Susan Thompson, Senior Senator from PSA 12. I don't know if any of you remember my presentation last year. This is a retread, if you will. I would just like to briefly go over it again with you. This is a proposal that has no fiscal impact to speak of, which is what I strive for.
It's actually very close.
I have learned over the years that people who are admitted to the hospital who are Medicare recipients usually have no idea that they have any rights with regard to their discharge date. And since I was here last year, I've even run into more people who say, I didn't know that. And these are all educated people. They probably have all received the written notice that Medicare requires that tells you that if you are discharged from the hospital, you can protest that, and you can have your discharge reviewed by an independent review committee, and that while that review is going on, which usually takes less than 24 hours, Medicare will continue to pay for your care. Most people who I've talked to want to go home, probably before the doctor wants them to go home. The ones that I've run into that should not have been discharged and didn't know their discharge rights were severely impacted by having to be released. Sometimes only a day or 2 days more would have made a big difference in their life. Since the Medicare discharge rights notice that is now given is a whole full page of small print that you're told when you go into the hospital. I'm sure some of you must have been in the hospital in the last few years. They say sign here, initial here, sign here, initial there. They hand you a bunch of stuff and you hand it to whoever brought you to the hospital and you're out of there. And that's the last you hear of it. The next thing you hear is usually, well, you have to go home tomorrow because Medicare won't pay for you to be here any longer. And that's all the information they're given. And the first people that I talked to that had a real severe problem had no idea that they had this rights. They had been told when the wife went in the hospital she would be discharged to a rehab facility because her husband was disabled and she would be on a walker. And so when they came in, they said, well, there's no room at the rehab facility, so we're sending you home. He's a retired attorney, she's a retired registered nurse. If they didn't understand their rights, nobody does. And of all the people I've talked to, I've only talked to one who actually was told at the hospital, these are your rights, and told in a way that she understood them. My proposal is very simple. Tell the hospital to nail a notice to the wall in the room that people are discharged from. Any regular hospital room that patients are going to be in and discharged. Just a notice saying if you're a Medicare patient, you have the right to appeal your discharge and Medicare will pay during that appeal. Here's a phone number. Pretty simple. Now, granted, the way we work probably would take one person a year or two to come up with a regulation to tell the hospital, nail it to the wall. But other than that, there should be no cost. The hospital can make up a form, and as long as it meets the requirements, that's all that would be required. I would ask for your support for this proposal. I think if the few people that it would help immensely. Yes, sir.
Thank you. Thank you for your report. Before we begin discussion, what was the vote last year on your...
It was unanimous.
It was unanimous. And what occurred after that?
Well, actually, I was new. That was my first session. And I got something, I think it was through I don't know if it was the newsletter or something that I got from the office, saying that somebody, a legislative person, suggested it was be picked up, but it was not, it was looking for a sponsor for it. But apparently nobody did pick it up, so it didn't go further. But somebody here was interested in it going forward, and they just couldn't find a sponsor, apparently.
So I remember it passed last year.
Yes.
I thought it was
yes, and in the Assembly also.
Okay. Anybody like to speak in support of...
I think Mr. Jaffe.
Yeah.
Senator, by coincidence, I was discharged from the hospital last week. Are you aware that Medicare has a contract with a nonprofit agency? It used to be called Lumeda, but they've changed their name just recently. And that organization is what you are suggesting that they could put the discharge of a patient on hold if the patient doesn't want to be discharged. They put it on hold for 3 days, and Medicare is not obligated to pay any fees or charges to the hospital until her complaint is mitigated between a physician of Lumeda or whatever their name is and the hospital. Now, if that is resolved, then the patient must follow the recommendation of whether to be retained in the hospital or go to a rehab or whatever, go home. Now, when I was discharged from the hospital, I went into a inpatient, and I was handed a patient's right by the Good Samaritan Hospital in Santa Clara County that spelled all these rights that I was entitled to, and it listed this, not Lumetra, but I can't remember the name of this other organization.
It has changed, yeah.
Pardon?
It has changed, and I don't remember.
Yes, it has changed, and it gave the phone number. Mm-hmm. I can't remember. I think that the phone number was actually on the discharge information of the patient. Now, my question is your proposal a little bit redundant as to what's going on now?
Well, I look at it as most people, now you read it apparently, and you had it in your possession. You didn't hand it to somebody to take home and put in the round file. People don't read that. There are regulations that require the hospital to put in writing your rights and have you sign that you received the paper, just like your privacy rights and all the other things they have you sign. The problem is that this is constructive notice, in my opinion, and not actual notice. Actual notice means that you actually have no knowledge of what's in that paper. A good hospital, and apparently you may have had an exceptionally good hospital, or a good person that checked you in. Some hospitals do. I found one person that was told very clearly what her rights were. Happened to be a hospital in Reno. The other people I've talked to have been in any number of different hospitals, and none of them were told specifically at a time when they were able to comprehend what was going on and understood it. And so, in a way, it's more. It is, I suppose, you could say it's redundant, but it gives actual notice. If you post it in a patient's room, they're going to see it, or their visitors are going to see it. And if it's in a piece of paper along with a half a dozen other pieces of paper, my experience has been people don't understand it, and they don't know it. Okay. Yes, sir.
I'd like to speak in favor of this, but I even like to take it a step further. Not only should you post it on the wall, but a discharge planner, a human being that you could speak to, should come into your room and tell you, I am the discharge planner. This is what we suggest will happen exactly when you're going to go home or go to a rehab, et cetera, and these are your rights, because very often, even if it's posted on the wall, the patient may be over-medicated or whatever the case may be. They're not really that cognizant about what's written on the wall to read it. But if someone comes in and sits down with them and speaks to them and tells them these are your rights and these are what you could do if in fact you feel you shouldn't be discharged immediately or tomorrow, and this is the procedure that's taken, and you have it as a federal proposal. Did you also have it as a state proposal?
No.
Just federal.
Just federal, because it's Medicare rules, which are basically federal as well.
Yeah, well, this really should be, I would have thought you could do both, because what happens if you had done a California version, and if it would pass, then you'd have some substance. What happens with a federal proposal, as some of you might know, it goes to the Congress, and unless you know a specific congressperson, you make them alert to this being sent, and they may think about picking it up. But very often, a lot of the federal proposals really don't go very far because it's sent someplace and who knows who has seen it or where it goes.
Okay.
So in the past, if you do a proposal such as this, it's good to start or do it simultaneously with a regular proposal.
Okay, and I'll talk to you later about.
Is there any more
where I should
testimony?
direct that.
Any more testimony in support?
Yes, this is amazing. I served almost 20 years as a HICAP director, and I can't tell you how many times I spoke to people who were indeed in this predicament. They were being told they had to go home. In a lot of cases, they had never seen a discharge planner because they are in short supply, as are the people who check you in.
Yeah, but that should be mandated.
Oh, absolutely. Absolutely. And I like this idea. I think it needs to be specified that whatever notice, whether federal or state, it needs to be within sight of the patient's bed and large enough type that they will see it, and possibly in Spanish and English if that's appropriate in that area. I think it's an excellent idea because people are so relieved. Most people, they want to get out. You're absolutely right. But those who just are not ready to go out and face the world or whatever need this kind of help. And it isn't always a relief. And I'm really sorry that it wasn't somehow furthered last year.
Yeah,
because I think it's...
Thank you.
Thank you.
Is there any more testimony in
Just
favor?
one affirmative. I totally agree with Ann and Ed. As one person, just their knowledge level, their background, and their suggestions, I think, are both very appropriate. Thank you.
Thank you.
Okay.
I agree with both of them also. It should be a slam dunk because it doesn't really cost anything too. So
That's exactly right.
Is there any testimony in opposition? If not, just in a way of discussion, I wanted to tell you, you may already know, that you can make it a federal proposal, and as you said, you have to find a congressperson, but you could also make it into a joint resolution by having an assembly person and a state senator endorse your proposal, and then they endorse it and send it to Congress.
Okay.
They have a better contact with Congress than you or I do.
All right.
So it's called a joint resolution, and there's no deadline for resolutions like they are for proposals.
Okay.
Just
Well,
let
thank you
know
very
that.
much.
Sure. Thank you for coming. We appreciate it.
Thank you. Have a nice day.
Does she leave before the vote?
You want to wait? Yeah.
Yeah, I thought that, please.
You can sit down. We have our...
We ask for a motion now for a vote?
Mr. Jaffe has his
Oh.
hand up.
Just going to say, I move the question.
Thank you. Question been moved and...
Second.
Second?
Okay.
All those in...
I'm going to take the vote now?
Yeah.
For individual? Okay. Senior Senator Steer.
Aye.
Senior Senator Ehrman.
Yes.
Senior Senator Jaffe.
Yes.
Senior Senator Casper.
Yes.
Senior Senator Miller.
Yes.
Senior Senator Woods.
Yes.
Senior Senator Fromm.
Yes.
Okay, that's a do pass. Is it a consent or is it?
Consent it's unanimous and unamended.
Oh, I'm sorry, it's actually a consent because it was unanimous and not amended. Great.
Okay.
That goes on the consent calendar now?
Yes.
Okay. Thank you.
Thank you. Next, we have Senior Assembly Member Kim Selby here. She has two proposals, SP3 and SP4. But first, there are some of you needed in other rooms, and we're going to have to maintain a quorum, so I will do this in the order that they were received. We marked it here in 2040 to testify at 1:30.
For me?
Yes.
Oh,
I don't know which bill it was, they didn't tell me.
2040.
And then you are to go now.
2040 is the new building.
Yes.
Saturday.
1:09.
Lisa, we need 5 people in order
Correct,
to have
so
a
1,
quorum.
2, 3, 4, 5. We will have 5.
May I leave? Will you have a forum in front of me?
Yes.
Yes. Yeah, we're good.
I'm going to have to leave.
No, we're going to stay and do it at,
1:30.
it's only 1:20.
We got to get there. All right, I'll wait. I'll wait till Kim Selby. Keep her hand up. I'm sorry. Are you going anywhere? You got a proposal? Oh, I got to get my proposal out.
Would you like to come up? Huh? Oh, yeah, that's right. We're still doing the Senate today. Sorry. I was ahead of myself. This is senior senator. She corrected me. I was a day ahead of myself here. Would you like to come up? Yeah, I'll have him sit down. You didn't have to make any changes.
This is Lorna Kim Selby, Senior Senator, and I'm proposing the stroke education, that is SB3, and then I also have another proposal, that is SB4, that's a defibrillator, automatic external defibrillator, that's also I'm asking. Yes, that's the first one. Okay. Well, stroke is about 80% is preventable if we do live right and diet and exercise. But we don't do that. That's why stroke is such a #1 cause of adult long-term disability in the U.S. And yearly, about 795,000 stroke is occurring, and usually stroke doesn't have any in other words, come in some kind of symptom coming before anything, but suddenly occurs. That case, something like 610,000 is occurring. That is the first, without any symptom showing. Person gets stroke, and then person who had a stroke and the second time around the recurrent is about the 610. So this is a very big issue, and so the leading cause of death in the U.S. And also this stroke is occurring at any age. It's not only 65 and over disease. Even 20-year-old can get strokes. So I'm asking stroke education to be going through the CSL. And for that, I will bring to you Heart Association is going through stroke education.
I'm sorry.
This is Heart Association is going through stroke education. Then there is such a thing as a senior needs lifeline screening, little gadget. They go through stroke education. And another thing is stroke prevention. This is happening in the community. And also, Contra Costa County, West County is poor county. So we have to sponsor the hospital. They come up with a medical notes and also stroke education. This is the most unusual stroke education because they don't come up with dizziness, one side is doing this, numbness, all that. It's totally different way they were addressing. So I think, for me, we should also get on with the community people. We should have stroke education. Instead of like last year, I got a total negative answer last year. So I'm bringing back this one again for you to reconsider. Some of you were here last year. So that's what I'm asking for. And then also what's happening is about 74% of the U.S. population do not know what symptoms of strokes are. So we have to educate them. We have to educate them. So other people are educating through any kind of means to going through this. So I would like you to vote for yes for this, so I can at least go to legislators to sponsor this one. I think this stroke was sponsored 3 times in the past as a resolution. But if I go there, when it's passed, when this passed both houses, both chambers, then I will go to the, some of those legislators and ask for whether this is. In fact, one legislator said, if this time yours is different from last year's proposal, then let me look at it. Let me see it. Because stroke is a very important one. So that's why I bring in here. And also another thing. Another thing is healthcare.
Excuse me. See what's going on here. What do you say? Alarm went off?
They're located, one's underneath here and one's back there, so maybe inadvertently somebody hit it. Okay, we're okay.
This door is not open. I was trying to open it, not open until he came out.
Yeah, it's not connected to the door, so.
That said members only, so. And healthcare cost is running after the stroke was suffered, then $41 billion, $41 billion. When I look at the whole thing, if 80% of a stroke is preventable, then why do we have to make $41 billion of expenses? So that's why I'm asking. This is very important. And it is the 3rd leading cause of a death after a stroke suffered. So that's what I was asking. And even Contra Costa County, we have about 22,000 seniors. Out of that, every day, 6 people suffer stroke. 5 of them are unnecessarily they suffer stroke because they do not do the exercise, right diet, and also they are not controlling their high blood pressure, cholesterol, diabetes. This is causing a lot of problems, and we have to take care of ourselves. So that's why I'm asking, would you please?
Thank you, Senator Kim Selby. I think that the committee understands the importance of stroke education, and I think that we would like to have people speak now in favor or in opposition of your proposal.
Thank you.
Thank you. Anybody?
I have a point of information, please. Senator Kim Selby, what exactly are you asking to be done? We all agree that stroke is preventable if people get the education. Are you asking X amount of dollars to be used for printable information? What exactly are you asking to be done for this proposal?
Well, so first of all, when I'm asking something like that, it has to have a written one. And also to have that as a government outfit, they have to have a bill.
If I get back.
So
yes,
after the bill, they can have going through, and then they can educate
I think in
them.
order for you, and you've done this a few years now, in order to pass something, you have to have something substantial for someone to read and say, is this going to cost $5? Is it going to cost $1 million to print this material? It has to be a substantive thing that you're talking about, not just a general. We all agree that strokes could be prevented, and if people had the education, but what means of education are you going to give them, and how is that going to be implemented?
All right. First of all, in-home supportive service people, caregivers, they are not educated. So that's what they have to do. So in order to do that, we will do, IHSS people will educate them. And also county will send out flyers and educate them. And also county will give education.
That's what has to be in your proposal, the specifics of what you wanted to do, and if there's a financial cost connected with it, how much will that cost be? Otherwise, you're going to, even if we all pass it here, you're going to get no assemblyman or senator to pick it up because there's nothing substantive in there. You have to tell them what you want and how you want them to do it, and if there's going to be a cost connected with it. Not a generality as you described it each year. That's why it probably doesn't go anyplace.
Can I speak on behalf of the department, since she is directing the California Department of Public Health to implement the programming for this? That's exactly right. At the program level, for us to execute a great campaign, which this is necessary, is we have to have monies dedicated and state, that would be state general funds dedicated to prevention. And the work that you want, you did outline where you would like to see the information provided at the facilities. However, that does take staff, state workers to be hired on to actually implement those programs and train all of those in-home supportive care educators. And so there definitely this would have to, I would think, go to appropriations and have a budget. So you're in. Cool.
Well, I think once it's passed, then when they call, Legislative Council calls, and then they will tell me what this is the way you want, that was in the past. And also in the past, 3 times they made a resolution, they did not talking about the funding. And also they said we will send out this as a resolution, and then each county will do their educating their people. That's the way it was. And so...
Do you have some clarification with what Senator Kim Selby is describing? Is that a plausible approach?
No, we would have to have a program actually established within our department that has funding mechanism to provide program oversight so that then we could go out and train our local public health staff to then work with their area agencies on aging and create a network so that then those in-home supportive care people could be trained, so that there could be educational and collateral materials developed in culturally sensitive frameworks to then get out to the individual senior centers and the other facilities that she's talking about. So an education campaign is the general idea, but there's very many components to that needs to be worked out.
Is there a possibility of, if money, a budget were generated to suggest it would be a grant to a nonprofit such as the Heart Association or something like that? I mean, you need somebody to do it. Obviously, state, I know everybody is very busy in public health, but I'm thinking use of a nonprofit.
It could be
one
done,
or more
but
agencies.
again, the governor is not going to be able to give money out directly to a nonprofit organization. It would still have to filter through us. We could get a subcontractor on to, yes, do the legwork if we have a hiring freeze and can't bring on a state worker to do that. That's done all the time. But there has to be money allocated and dedicated, obviously, to it. So she might not have to go through all the details, but there does have to be the acknowledgement that it needs to go to appropriation because a program will not be able to do what she would like without that. But she doesn't have to figure out all the nuts and bolts and how to do our public health work. We know how to do an education campaign.
Yeah, but she has to specifically say what she wants. Am I correct?
Yeah, that there should be a program established within the Department of Public Health to conduct an education campaign. We do have a heart disease and stroke campaign, but the majority of that is funded through the CDC. And they don't have as much money as necessary to do a statewide campaign.
So is there a suggestive amendment that the author could gleam onto and maybe make her proposal a little more substantive?
Well, I would suggest that there's probably going to have to be a dollar amount attached to do the programmatic efforts. And usually do a program like this, you need at least 1 to 2 staffers, you need an admin, and you need a program lead. And it would be obviously housed, this campaign, within our existing heart disease and stroke program.
Could you suggest a dollar figure to her to put it into an amount? I don't want to put you into something you're not comfortable with. But in order to get this rolling, because this has happened for 2 or 3 years in a row, and it goes nowhere, it's important, but the way it's structured, it will go nowhere again.
I think she'd have to do some more legwork. I mean, I could come up with an arbitrary number, and I know what it costs as I run programs, but I couldn't speak for my heart disease and stroke colleagues. But if she actually went to them and they really worked out a plan on how, and the cost benefit.
Senator Kim Selby, are you aware that there are people you can go to speak to and maybe make your proposal stronger and come back next year with actual details for the proposal that may be able to pass?
You know why I don't put any money in it? Because I know the budget is so tight. If I put the money in here, they are not going to go through. That's the reason why I am not putting any money in it.
Yeah, but people know there is money connected with it, and so you're between a rock and a hard place. You can't get it done without being specific, and then if you're specific, you may not get it done because the dollars may not be available.
That's right.
But you've tried it your way. You may want to try it the other way. Just a suggestion.
That's why I'm saying, if locally IHSS people are going to have this one done, then they will bringing in at the local. It's a stroke education association, stroke education, or part association.
Yeah, but if you do IHSS in Contra Costa County,
yes,
and I live in Los Angeles County, my people aren't going to get that education. It'll just be in your one area. So your area could just do that on your own. You're looking for something that could be statewide.
That's right.
Yeah, but the way you structured it, it can't be statewide.
That's what I'm looking for. Otherwise, I will not come in here, and because Contra Costa County is doing not only this stroke education, but actually we are putting in a film, so we will produce and broadcast through the county's TV program. So we are doing it, and everybody thinks that was a great job because they were doing it. But like your county, you said you're not doing it. Well, then you're not going to just do anything because nobody's doing it?
If your county is doing it, have you done any sort of research to see if the rate of strokes has gone down?
You know what we do is this. As IHS people, they have to provide this education. So they will get all the IHSS providers. And then we will go out there. And then we are talking about the stroke, what's all about.
Who's we?
So they can see stroke is coming. So they can.
Okay, you need to say who is we and who is they.
Who are they? Because advice comes from the aging people. Will go out. We have about 5 doctors in our council, and they go out and then talk.
Okay.
And also, we are doing, as I said, a TV program, and also we have a little magnet. showing stroke is...
Okay, but I'm thinking if you could show that the campaign that you have going locally is having tremendous results, it would be something to build on, and it would be far easier, I would think, to sell it, in quotes, to anybody in terms of getting it to be more widespread. Because I don't think there's any of us who aren't with you. It's just, it's how to get things done in a time when it's so, we're all so inundated and the money's not there. We're trying to think of ways to get it, make it
You could
easier.
replicate the program you have in specifics in your proposal that may be able to be used throughout the state. That would make sense.
Yeah.
I agree with you.
Yeah.
Well, you just said a few minutes ago you would like to do some amendment. Why don't you do the amendment if that's the way you want it?
No, well,
But last year you came up with an amendment, but you didn't do that either. And then you just said no.
we're not able to do that now because we don't have the specifics. You would have to do it and come back next year with the specifics.
You know, last year you didn't say that. You just said a no-go. But you did not say you have to come up with any special things. That's what you didn't say. But this year you're saying, okay, this year we're going to fail it again, but next year you better come up with something substantial.
Because we want you to be successful, Senator Kim Selby. That's why we're suggesting it this year.
Oh, it's all right. Then you go through the voting, and then it's okay with me. I don't have to do anything. It's okay.
I just wanted to say, I think the idea is a good idea, but it's not always, not necessarily a senior problem. I think the education needs to start sooner than that, so your arteries aren't plugged, you don't sit on the couch, you don't eat steak every night. It's the kids that are growing up. I mean, that it's your personal responsibility to do these things to prevent it. I think your information would help prevent it, but when you're a senior, it's kind of too late. I mean, it's never too late, but it's your body's sort of
against you.
Yeah, it doesn't, I don't know how to word it, but I think
the odds are against you.
Yeah, put it nicely.
Call for the question.
I second that.
Thank you. Call for the question. Let's have the vote.
Okay. Senior Senator Ehrman.
No.
Senior Senator Casper.
No.
Senior Senator Miller.
No.
Senior Senator Woods.
No.
Senior Senator Fromm.
No.
Okay, that is no on SP3. And next we have Senior Senator Kim Selby speaking.
So that would be failed, all right?
Failed, yes. Mm-hmm.
For the no, I'm just saying that for the new members.
Yeah. Okay, next we're going to have her address SP4, which is on automated defibrillator signage.
Senator Kim Selby, are you ready to present?
Yes, this one I don't have any government funding. This one is a defibrillator, and this defibrillator is supposed to have at the health studio by July 1, 2012, and then that will be trained by January 1 of 2013. And currently, the statistics shows 325,000 deaths occurs by this sudden death syndrome in the U.S. And I'm asking signage. I'm not asking defibrillator to be installed in all these places. I'm asking once they were installed, they must have a sign outside of the building. So if anybody suffers suddenly a seizure, then they will go into that building because the building says there is AED defibrillator available inside that building. Because once anybody suffers this sudden death syndrome, there is only 3 to 5 minutes period. If that time person can have AED, then that person will survive. If that time passes, that person will die. So I'm asking that signage, but not the government. Person-owned AED in that building will just put out that sign and says they have that. So that person suffers from outside will be able to go in there and get that help. That is my proposal.
For those of you that might not know, I was the one through the CSL that we got the Health Studio AEDs put in that is currently in effect. So it was through all of this, and Kim knows that. We've talked about it before. Kim, I totally agree with the concept, I might add. One of the things, my dentist that I go to has an AED, and he has a sign there, some sign. I don't know what it is, but it's got the identifier of AED. All I'm saying is it possible that it's already being done? And is there, what you're suggesting maybe is a universal one? It is not that.
No, that's the thing is hot.
No, it is not. What he has in his office is not a heart.
Electrical current, that's the prevailing one. And that's what they have is once they install the AED.
What you're suggesting is that we create.
Under that, they have AED sign with this heart.
No, there's no heart. Believe me, I've been there enough times. But there is a reference to the fact we have an AED, and there is a sign, but it is not a heart. And all I'm asking is that there may be some common signage already existing.
No,
at the airport.
Right.
At the airport, there are defibrillators.
Right.
And there's a sign. I'm sure there are. Yeah, and there's a sign that goes with them.
Yeah.
But what I think what her plan, correct me if I'm wrong, is to add it to the exterior of Health Studios so that someone on the street would know what's inside.
Right. Okay.
Is that right?
That's correct.
Okay.
Okay.
Then I agree with that. I agree with any amount of advertising that allows people in the public to know that help exists.
Right.
So in that sense, but what I'm concerned with is you're saying one kind of sign. We need a universal one, which is what your proposal is. But I can guarantee what I've seen is not a heart.
I think it has the outline.
Okay.
Was it?
Is that what it is? It's red and white.
Yeah.
Oh, okay, yeah.
Yeah.
I know the man that he died now, but I know the man that invented the defibrillator.
You know, that defibrillator is manufactured 3 or 4 different companies. And each company so far have their own way of expressing it. Therefore, I'm saying outside, I don't care inside what kind of thing they have, their logos. That's because that company's logo. But outside, at least uniformed signage is available so people can see, people can tell that the building has AED. That's what I'm asking. And when they do make sign, then at their own expense. That's what I was saying.
At their own expense.
And
the thing is making it a universally recognized sign. That is
like a crossing
most
sign.
important to me.
Yeah. Or disabled parking.
Right, exactly.
That's exactly what I was saying. If this thing is once implemented, then people will be educated just like disabled people's wheelchair sign. That's what I was saying.
And you might even throw that word in there on some of the universal signs.
But that's what I said, universal sign. Universal sign, that's what I said.
The verbiage should be something like any facility that has a defibrillator should have universal signage that they have a defibrillator on the outside of the building.
Or available to the public. I'm thinking of a mall.
Yeah. Public access.
An appropriate spot.
Right.
Yeah,
Why are you saying outside of the building?
Because
That's what's in the proposal.
she wants, they could be a defibrillator in the building. You could be walking by the building and you could feel like something's happening. You may be having a stroke. If you saw that universal sign, you could go into that building and your life may be saved.
Okay.
If, with the bill that has passed, Irwin, was there some regulation about usage that you have to be trained? Because I'm not.
You're absolutely accurate. They were required, the health studios were required to have a defibrillator and trained personnel.
Okay, so they would have they would have the mechanics and also the ability to implement help.
Trained personnel.
Because then that would be indicated.
Come up, and I'm not sure how they solved it completely yet, but some of the health studios decide they're going to stay open 24 hours a day. But then they said, well, I'm not sure we can afford to have 24-hour coverage. That's not what the law says. The law says if you're open, you provide the coverage and the protection. So
that's true. It's
Okay.
January 1 of 2013, they should have trained personnel who can apply for that AED to the person who suffered it.
Let's call the question, please. Can we call the question? Oh, I'm sorry.
Are there anybody?
Wait, I just wanted to ask
speak
who
in
would be
favor or in
responsible for the cost of the signage?
The person or company that purchased it.
But how are you going to enforce that? Like, to me, it would.
be in the bill.
Yeah, but to me, if you bought a defibrillator, maybe a sign could come with it, or, you know, that way you've got it.
That would be great if the manufacturers, that she said there's 4 manufacturers, if they could come up with a common sign that would be shipped with the product, that would be perfect.
You're right.
Is there anybody who wishes to speak in favor or in opposition or discussion? Call for a move. Anybody want to second the motion?
Second.
Okay. Roll call, please.
Certainly. Voting on SP4, Senior Senator Steer.
Aye.
Senior Senator Ehrman.
Aye.
Senior Senator Jaffe.
Abstain.
Senior Senator Casper.
We need, I guess I'll have to say no. I'm sorry.
Okay. Senior Senator Miller.
Aye.
Aye, she said.
You said aye?
Yes.
Oh, I'm sorry. Senior Senator Woods.
Aye.
Okay. So we've got. This is a due pass.
What was the count?
It was 4 ayes and 1 nay and 1 abstain.
So it passes.
It's due pass.
It's due pass.
Well, thank you so much.
Thank you, Senior Senator Kim Selby. What happened to the first motion?
Yeah, oh yeah, wouldn't be hard. Okay. Yeah. Difficult. Well, that's the thing. I mean, I think it's a good thing. It just needs to be a little bit changed.
But she didn't have specifics.
Thank you. Thank you.
She didn't say what she needed, how much it would cost, who was going to do the education. It was just, everybody will agree with that. Yeah.
Well, we have completed our work today.
Yes, we have.
We only had 3 today, and one. Is there any discussion? Before we adjourn, does anybody want to discuss anything for the Health Committee?
You're going to get the
Somebody, tomorrow we have, I believe, like 8? 8 tomorrow, so we'll have to avoid, the time will have to be divided, you know.
We really need to go back on that.
Well, you should read the proposals for sure, yeah, and, you know, tomorrow, we'll have,
I'll be here tomorrow. We have, I think
we have like
assembly
8
bills tomorrow. Yeah.
8 proposals tomorrow.
Depending on
8?
the number of people and the number
I mean,
of
depending
hours
on which
we
ones
have,
pass out of committee
usually
today.
split it up by, you have 10 minutes or 15 minutes or whatever.
Yes, 8.
There's 8. I mean, you have to assume that not all of them passed, but you have to. We won't know till tomorrow what the votes on those were. So we'll have to assume that there's 8 tomorrow.
Okay, I have a question. We discussed the bills in our legislative meeting at home, and so there were several that were not really senior issues. Is that a problem, or does it matter?
I think I understand what you're asking. If it's not in the binder, it's not going to be here.
I mean, they're in the book, it's just that it could be for anybody.
You're including people with disabilities.
The Joint Rules Committee, who received the proposal, they decided that it was an appropriate for our...
Yeah, the Ledge Committee does that.
You know, for the legislature, with the Ledge Committee. So people review it. If they thought... Right, and you know, once they thought it was appropriate for the CSL, then it goes on the docket, so to speak. Yeah.
Okay, thank you very much. The meeting is adjourned.